I was at Tennessee American College of Surgeons, which this past year in 2026 was in Paris, Tennessee, so a little town. I had just come off call and had a really tough experience with an unexpected necrotizing soft tissue infection on a healthy young man, and just really kind of found my hands tied. Was feeling like I really needed some help to kind of figure out what to do next. We had just finished his debridement. By some amazing serendipity, while I was at Tennessee ACS, came across the Integra table, met a surgeon who had had a great experience with micromatrix, met Casey there, and we talked a little bit about my case.
She had a patient identified that she felt our product would be beneficial to, and that helped us be able to fast track through value analysis, make the product available, and that next week we were using our portfolio at our level 1 trauma center.
When we discussed where I was with the case, which was quite literally post-op day 1, realized that I could utilize micromatrix to help this man get back to his life.
For me, being new with Integra at that time, being new into this industry, meeting someone like Dr. Zalamea was almost a breath of fresh air.
By utilizing micromatrix, actually, it makes sense with the science. I do think that on a tissue level that we're able to kind of tilt the scales towards viability. And when we do use the micromatrix, I think it's helping us salvage those areas and planes that might be on the border at the beginning. And then what's lovely about, I think, the portfolio is that we can move with the patient. So as we stage and we are able to build up the base of the wound with micromatrix, even on occasional cytal, then we can get them to a place where, again, once prime matrix was available, we used it. And for me, the win is not just in the hospital, is seeing the patients back to work, getting them back to life, talking to them on the phone and saying, everything's great. What was remarkable is when we were discussing his case at the conference, I wasn't as worried about his survival, his ability to physiologically get through a necrotizing soft tissue infection. He had youth on his side. He was incredibly healthy. His critical care was very quick. He was able to turn around really fast. What was most concerning to me was how he was going to get back to work. How would we cover this? Is it going to be a giant skin graft that's going to contract and limit his mobility? Is he going to be able to do deadlifts and lift weights at the gym again? Is he going to be able to work with his hands again and lift his child? I actually spoke with a patient about it. I said, traditionally in a situation like this, we would be placing a wound vac on you, changing it every 3 days and hoping for the best and waiting until you're graftable. In this situation, now we're empowered. And I talked with the patient about it. He was excited. This was my first opportunity to do this. I'm thinking about all those muscle planes that were full of pus, the anatomical dissection of the different muscle bellies. Micromatrix was able to fill those in and bring the wound to the surface. That was a huge win. And so getting it to a place where he was able to get grafted within a very short period of time, and then, of course, get back to life was really all that I wanted.
Once he got to his split thickness skin graft, I happened to be sitting at the front of the hospital one day waiting in between cases, and I see him and his mom. And normally I come in after the patient's asleep and I'm gone before they wake up. So I see him and his mom coming in and I'm sitting there telling myself, should I introduce myself? I'm kind of battling back and forth, and I make a decision to walk up and I said, hey there, I said, you don't know who I am. I said, but I know you very well, and I've been a very, very small part of your journey, and I just wanted to introduce myself and tell you how happy I am to see where you are now. He was walking, he was smiling, and that was for me just this full circle moment where I almost felt emotional about it, because it's easy for us to, as reps, when the patient's already asleep and we're gone before they wake up, it's easy to not get that human aspect of it. So that was a very, very cool moment. It's just to see his progress from start to finish and see him walk in and be able to shake his hand.
It's such a big drop off. You do the operation and then the body has to take it from there. And there's this huge gap. And I feel, especially in these cases that we've had since we met, we've been able to utilize some tools to be able to help them bridge that gap to allow their immune system to take it from there and say, we're going to help them and empower their immune system to help build up this wound so they can get to a functional outcome faster.
Being able to be a small difference in even just one person's life gives me purpose. So I feel like I have a purpose waking up every day, going to the hospital, trying to identify different opportunities where maybe I can contribute and to bring value. And that's really important in life, to have something where you feel like you have a purpose. Up until this point, I'm not sure I had that. And that plays a lot in your life, off the field, at home, in your relationships with your spouses. So it just bleeds into the rest of your life. So I think Integra gave me that. It gave me that sense of purpose.
From a surgeon standpoint of view, you've been incredibly engaging and supportive without being, pushy, but you provide the information that I needed, and the means to do it. When we first started, there was no product on the shelf. We quite literally put the paperwork together and said, okay, what do we need to do? And of course, I was communicating all of this with the patient. He said, okay, is the magic stuff here? I was like, it's not magic, but we're going to do it. It's like, okay, let's do it.
Things are going very, very well, and I couldn't be more thankful or grateful to be working for Integra.